For years, alarmist headlines have warned about the negative effects of social media on mental health. From Instagram to TikTok, they have pointed out that they are responsible for increasing anxiety and depression, especially in adolescents. But what if part of that narrative was based on an incomplete idea? Before continuing, I invite you to subscribe to our channel and give like to this video. Your support helps us to continue creating relevant content on important topics like this. Now, let's delve into this interesting study that challenges common beliefs. A new study published in the journal Behavior Genetics offers a more nuanced view of this issue. Researchers analyzed 6,492 people between the ages of 16 and 89 using data from the Netherlands Twin Register. The objective was to untangle the real links between social media use and mental health. What they found might change the conversation. The study reveals that the link between the use of social networks and psychological well-being is small, even insignificant in some cases. However, the most revealing thing is that these small associations are, to a large extent, determined by genetic factors. This means that social media does not directly cause anxiety or depression. Genetic predispositions that can lead a person to feel less happy also influence how he uses social media. This finding challenges the idea that digital platforms are inherently toxic. According to the results, up to 72% of the individual differences in the time we spend on social networks could be explained by genetics. This suggests that we should not demonize TikTok or Instagram evenly, but understand that the digital impact is more personalized. The study also identified interesting patterns according to the participants' welfare levels. Those with higher levels of life satisfaction tended to use more platforms passively, while those reporting less well-being were more likely to publish frequently on fewer platforms. Paradoxically, it was found that flowering was positively related to increased use of social networks. This indicates that some people with good mental health can benefit from their online time, adding complexity to the discussion about the use of networks. Using twins in the study allows researchers to estimate how much of a behavior is influenced by genetics. Comparing how the use of social networks and well-being between twins were related, it was concluded that similarities were strongly linked to genes. This study suggests that banning or limiting access to social media is not a magic solution. Not all people are equally vulnerable to the negative effects of digital use. The problem may be more in the user than in the tool itself. The key might not be to disconnect from the digital world, but to better understand how we connect with it. It is essential to stop looking for universal culprits for deeply individual problems. The complexity of human behavior requires personalized strategies.